Hi, I'm Jonathan Baillie, editor of Health Estate Journal, the IHEEM magazine, and I'm with Alison Ryan of Mott MacDonald, who's been the IHEEM president for the past 2 years, who's agreed to have a quick chat on the eve of healthcare estates. Hi, Alison. Thanks for doing this.
Hi.
Can you tell me a bit about your own professional background, how you got into engineering, for those who don't know you so well?
Certainly. So I have a mechanical background. I've been in healthcare for sort of 23 years now. I've actually been part of IHEEM pretty much for that amount. So I studied physics, maths and geography at school, and then went actually on to do a physics degree at university. Then I decided that I'd like to go into a career in building services engineering, partly because of my dad, who was an electrical engineer and did a lot of healthcare work. And I then actually went back and did a HNC in building services.
What made you decide to do that?
I think, the HNC?
Yes, the HNC.
I think I knew that it was going to be really applicable to my day-to-day job. So obviously I had the sort of science academic type background. But yeah, a few colleagues had sort of recommended that I did that. And yeah, I very much benefited from it. And then I went on to do a master's degree via Brunel, by distance learning, to then become chartered. So yeah, that was pretty much
You were chartered at quite a young age?
I targeted getting chartered by the age of 30.
And you did that,
I did that, but of course, just before my 30th birthday, I actually got diagnosed with a serious illness. So that did set me back a little bit. But yeah, I think it was in my 30th year anyway. Yes.
Can you tell a little bit about the illness you had?
Yes.
How good the NHS was at the time?
Yeah, absolutely. So I was diagnosed with non-Hodgkin's lymphoma back in 2010. I had really not sort of any obvious symptoms at all. Actually, I started with a blood clot in my left arm, but that escalated very quickly. So I actually went to A&E and got scanned and a few blood tests, and yeah, they found out that obviously I had I think it was a 9 centimetre by 6 centimetre mass just behind my sternum. So yeah, I went through, I think it was 8 rounds of chemotherapy and 15 sessions of radiotherapy. And the NHS was absolutely brilliant, as in I was fully supported by them, and of course the charity Lymphoma Action as well.
Aside from going through that and the rigours of that, which must have been very difficult, how did that affect you sort of studying? And
so I'd finished all of my qualifications by that point, but certainly I didn't realise actually sort of the fatigue and of course the side effects of the illness. I did continue to work, but yeah, it certainly did have, it absolutely disrupted my entire world, I'll just be totally honest. But I'm a very positive person, I think. You can see that. But, so yeah, I kind of...
Yeah, I've always thought you had great resilience.
Tried to get through it like anybody would, just day by day. And yeah, work did actually get me through it. I'd say it was a good distraction for me, but clearly, yeah.
Were you working at one stage for the same firm that your father had?
Yes, I worked.
Tell me a bit about that.
Sure. So I worked for a company called DSSR. And yes,
are consulting engineers?
They are. And the DSSR Harrogate actually stemmed from the Yorkshire Regional Health Authority. And it was a pleasure, to work with my dad, who sadly passed away with prostate cancer, which is the charity that, of course, we're supporting at the gala dinner tomorrow. Yeah.
And how long were you with DSSR for?
I'd say the best part of 20 years. So,
really?
Yeah.
And working a lot on healthcare, or was it wider than that, or was it mainly healthcare?
It was mainly healthcare, and I did take, I'll call it sort of a 1 year sort of sidestep, but I really realised that healthcare was what I wanted to do. So, yeah, the best part of 20 years.
What was it about healthcare that particularly appealed to you?
I mean, I think it's just so there's some really specialist and interesting certainly mechanical design aspects, all of the sort of ventilation, operating theatres. Yeah,
which of course is dynamic and has changed with HTM guidance.
Absolutely. Yeah, so I think it's just, for me, it's just something that's so interesting. there's always something different. There's always a new challenge, that we've got to try and overcome.
And presumably with COVID, there have been lots of sort of changes in thinking as well.
Yes.
And ventilation,
absolutely.
of space.
Yeah, and whether you're looking at 6 air changes or increasing to 10 and future proofing and all of that resilience, like you say. Yeah.
What do you think you got most out of being with DSSR?
I think just such an incredible grounding in terms of knowledge. The wealth of knowledge in healthcare design. I was able to work on projects stemming from sort of £1 million up to 20 million, and then there was one very large project that was sort of in the 380 million mark.
Which one was that?
That was Southmead. So
Bristol.
Yes.
So that was one of the PFI hospitals.
Yes. Yeah. So I worked on that. I think it was in 2008. But again, that was something different because it was a much bigger scheme. So it was interesting just to be involved at the start of that project.
And does DSSR have quite a long pedigree in?
Yes, I think they're well known for their healthcare expertise, definitely.
And when did you move to Mott MacDonald? Because your current role is?
I'm the Deputy Healthcare Technical MEP Lead.
Yeah. Based in Leeds?
I'm home based, but I have a national role. So I started with them in 2021. So I've been with them about 3.5 years now.
And you've worked quite a lot, and you've had involvement in the new hospital programme.
Yes.
Right? Can you say any more about?
Yeah, we've obviously been supporting in terms of the NHP programme. My particular role has sort of been on the technical advisory side, so I've been reviewing some of the schemes and commenting and providing sort of some advisory sort of.
That must have been an interesting proposition for you.
Yes, that was, and it was one of the reasons why I joined Mott's, definitely, because to be involved with the new hospital programme is something.
Are you working on any very large schemes at the moment?
So we're working on a number of the sort of RAC hospitals.
So
clearly
that's reinforced autoclaved aerated concrete.
Yes,
which the NHS has found it's quite a number of hospitals built in the 70s and 80s.
Yeah,
and
absolutely.
schools, I think.
Yes.
So how much of a challenge has that been for the hospitals involved?
Well, of course, it's a very serious issue. I mean, for me, the key is that we're working with certainly NHS trusts to help them sort of resolve the issues, and try and keep services running. That's important. For me.
It seems amazing that so many buildings were built with this material, but I guess, was it a cost-saving measure originally?
Well, I think it's like anything. Somebody obviously had an idea that to build something that would be sort of fit for purpose for sort of 30 years, but like a lot of temporary buildings, they've been, certainly in healthcare, they then remain, don't they? So, with healthcare, needs are ever evolving. So, the buildings, are no longer sort of fit for purpose. Yeah.
And when did you? How did you become IHEEM president? How did that happen? How were you notified?
So, like I said, I've been involved with IHEEM for pretty much the same length of time as I've been in healthcare engineering. So I've been on sort of regional branch committee, and I've done sort of roles like secretary, treasurer, chair.
The Yorkshire branch.
Yes, the Yorkshire branch. And then I was asked to chair the professional development committee, which is something that was really important to me because it's about professional registration and helping others. And then, of course, in National Council. And then, I was asked if I'd be interested in becoming president. So that was been a...
And you've also been involved very much in equality, diversity and inclusion for IHEEM, I think. Can you say a bit more about that?
I mean, I think it's just, trying to encourage the next generation to become engineers. So, that's something that, I get involved. I'm a STEM ambassador as well. I'm trying to kind of promote.
I think you're known particularly for your presidency during that time for having done a lot of STEM work in schools and colleges. Have you enjoyed doing that?
I do. I enjoy doing that. And
what do you enjoy most about it? Going in and talking about the role?
I just think, to be honest, it's just, it's so inspiring. It's sort of a two-way thing, as in, the sort of next generation. It's just really interesting to see and try and sort of promote engineering and get, younger people involved. I don't think, and I still don't think that many young people know what sort of engineering is and the number of sort of disciplines. So that sort of, it's keen for me. I think, I suppose promoting, my sort of specialist.
Do you think that lack of knowledge applies more to engineering or healthcare engineering? Because I guess there are some of them will know about computing and IT and gaming aeronautical engineering, but may not realise what's involved in running a hospital from an engineering standpoint.
I'd agree. And I mean, if you just type in a search for how many types of engineering, it just comes up with, so many. And for me, it's a way of letting people know about healthcare engineering in particular and trying to promote it.
Do you think the balance of women has improved much in your time since you started? Do you think women now have much less of a sort of ceiling and do have the opportunities to progress?
Yeah,
healthcare engineering and estate management.
Yeah, I've definitely seen that, and I work with a lot more female engineers now. From all backgrounds. As well as structural. As well, a lot of architects. So it's definitely. I think it's definitely increased. Yeah.
What else have you enjoyed about the presidency, particularly?
I think I've really got to know sort of the IHEEM head office team, and it's been an absolute pleasure working really closely with them and all of the IHEEM technical platforms, and getting to sort of know what each platform does, and clearly the sort of the expertise that we have. That's been fantastic. And of course, last year in November, I had the opportunity to go to Hong Kong. Our Hong Kong branch celebrated their 25th anniversary.
Which we reported on in HEJ, and Alison contributed to a very interesting article on that.
Yeah. So that was definitely a highlight as well. Yes.
Yeah. Do you think you'll miss being president? Or, I mean, I guess it is an additional sort of a responsibility and quite an onerous one with an institute like IHEEM.
I mean, I'd love to kind of continue to be involved. And so I suppose the key is that I'd like to, continue chairing the IHEEM mechanical technical platform and certainly support at sort of future events. Yeah.
And that mechanical technical platform is one of the newer ones, I think. Were you instrumental in setting that up?
Yes, and of course with my background, it was certainly an area that I was keen to get going, I suppose.
Yeah, and I guess you know Nigel, who tomorrow's AGM will take over, Nigel Keary from you.
Yes.
How well do you know Nigel and his work?
So I suppose I kind of got to know Nigel from being on National Council. I mean, I think he'll be a fantastic president and ambassador for the Institute, definitely. Yes.
What are you looking forward to most at Healthcare Estates?
I think hearing all the updates in terms of digital and anything to do with sort of the future of healthcare. That's my,
What do you think? It's quite a difficult question. What do you think are the biggest sort of challenges for the healthcare estates and healthcare engineering community at the moment? Is it an ageing estate particularly, or is it the workforce trying to encourage more young people in?
So I think it's a combination of things: funding, clearly, backlog, workforce, and then climate and energy resilience. Obviously, we've got an energy crisis at the moment, so all of that. In terms of backlog, I was reading the article in the HEJ about the 11.6 billion of backlog, which I think is more like 20 if you kind of factor in everything else. And I think they're the challenges. And I suppose the key is that IHEEM, how can they be addressed? I suppose,
The NHS is obviously a pretty big contributor to carbon footprint. How optimistic are you that NHS Trust and the NHS can have a big impact in reducing the UK's carbon footprint?
I'm optimistic, and certainly in the last 5 years, I've seen a massive sort of emphasis on trying to get to net zero. So I am optimistic.
And that must come well within the sort of remit of your job.
Yes, we're certainly working on a number of roadmaps to net zero. So yes, I think we're on plan.
And are you speaking at Healthcare Estates?
So I'll be doing the opening address tomorrow, and then of course the AGM and handing over to Nigel, and then I will be chairing the digital session on Wednesday.
That should be interesting. Yes. So that is about the general move towards more digital hospitals.
Yes,
which is something you're seeing quite a lot.
Yeah, absolutely. But I think there's a sort of a lot of unknowns, or sort of which particular areas of digital. I think that's something that will be of interest.
Do you think it'll be as much in the patient-facing areas as it is on the engineering side?
I think it will be all areas, and the key is that we've got people from all disciplines that can advise on each sort of area. And in terms of the future of healthcare, I think well-being, sort of prevention, enabling, empowering patients to sort of navigate their own health, and they're some of the key things as well. Yeah.
Thanks very much, Alison. And can I give you a personal thanks for all the assistance you've given me and input into the magazine since you've been president?
Thank you. Thank you very much.
Thanks very much.
Thank you.
Yes.